we'll be talking about how the pandemic is overwhelming the healthcare system, which means access to unrelated medical care, such as sexual and reproductive health services, may be restricted. Joining us is Olivia Netta, who is a communications officer at Population Matters, which in its work supports grassroots organizations that offer sexual and reproductive health services to underserved communities in both the global south and the global north.
Women are having a harder time getting contraception and things like pre- and postnatal care, as well as treatment for sexual and reproductive health issues. So it is a difficult time for sexual and reproductive health.
In a webinar organized by Sexual and Reproductive Health Matters to discuss the implications for sexual and reproductive health in the face of the COVID-19 pandemic, Faisal El-Kak, the Vice President of the International Federation Gynecology Obstetrics, FIGO, says we are in for a long battle.
We all know that as FIGO, that women is going to suffer more, not only in their health, but now staying home. This might be suffering a lot, whether because of unintended pregnancies in view of the shortage of contraception, of interruption of the services.
Chris Paddy, the CEO and president of DKT International, one of the largest suppliers of contraceptives, HIV, as well as abortion services, products and technology in over 90 countries, including Uganda, Kenya and Tanzania, warns that there is going to be disruption with every link in the supply chain.
And that disruption is, I fear, going to result, if things aren't addressed quickly, is going to result in more stockouts and shortages and lack of access in the coming months.
So some of the major condom factories in Asia have had to close temporarily.
China is coming out of their shutdown, but in the last couple of weeks, Malaysia factories have been shut down. The largest condom manufacturer in the world is not producing condoms right now. The largest IUD manufacturer in the world in India is not able to produce IUDs right now. Bangladesh is shut down. Thailand has gone on shutdown. And of course in Europe, some of the big pharmaceutical companies that are in Europe are experiencing disruption.
If a woman has a prescription due for a renewal, it's possible that she might not be able to get a doctor's appointment to be able to renew that prescription.
We're trying to work on replacing, if some of them are using daily oral contraceptives, to be replaced by IUDs or more permanent way of contraception in case people will have upcoming more severe circumstance that will prevent them from leaving. As I speaking, the government is issuing more measures preventing people from leaving, except for 2 hours a day for specific food markets, and nobody except healthcare providers are allowed to go out. This is applied to the host community. It's applying for the Lebanese, the non-Lebanese, and also for the Syrian refugees and to the Palestinian refugees, in order, as you all know, to flatten the curve.
With all this, should we be concerned about a baby boom?
With our Egypt office, all pharmaceutical companies have put their medical reps and salespeople on a 2-week vacation while they figure out what's going on. DKT is the sole provider of IUDs in Egypt, and I'm concerned about what's going to happen in 9 months from now. You know, if women aren't getting the IUDs that they need. Obviously, these things don't happen overnight.
When we look at history, we can see that birth rates tend to decline after pandemics, actually, and it takes them quite a long time to recover back up to their normal rate. So it's unlikely at this stage, but we also don't know how long this pandemic will last. So people are aware of this, and many people will therefore naturally try to avoid getting pregnant during these uncertain times. But if we're also facing major contraceptive shortages, it's of course entirely possible that this will increase the number of unintended pregnancies, which of course is never a good thing. So at this stage, there's just so much uncertainty, so we just don't know how things will pan out.
The reproductive health community has certainly been challenged, and we can only hope that things get better much sooner. Florence Blundell here in London.